The house on Ocean Avenue seemed quieter than any other building on the street. It wasn't a typical silence, the kind that accompanies quiet neighborhoods at nightfall. It was a thick, almost physical silence that seemed to absorb sounds, footsteps, and even thoughts. When Richard Coleman parked his car in front of the property for the first time, the engine shutting off echoed like thunder in his tired head. He had recently moved to Amityville after accepting an administrative position at the local hospital. The transfer promised tranquility, routine, and a chance to start over after a difficult period in his personal life. But the house he had bought quickly became the center of something that no one could explain. Richard was a methodical man. At 42, he maintained rigid schedules, predictable habits, and an almost obsessive discipline. Co-workers described him as reliable, yet distant. Patients rarely remembered his face, only his calm, neutral voice. On the first night, Richard didn't notice anything unusual. He unpacked boxes, organized documents, and walked through the narrow corridors with a flashlight. Still without having installed all the light bulbs. The floor creaked unevenly, as if responding to the weight of someone invisible walking behind him. He ignored it. The second night was different. Richard woke up at 3:17 a.m. with the feeling that someone was watching him. There was no noise, movement, or obvious shadow, just a primal unease that kept him motionless for several minutes. The digital clock displayed the time with pulsating red numbers. 3:18, 3:19, 3:20. Sleep did not return. The following morning, he arrived at the hospital with slight dark circles under his eyes, but behaving normally. He casually mentioned to the head nurse that the change was still affecting his rest. "A new house always takes time to become a home," she replied without raising suspicion. The following days established a pattern. Richard wasn't sleeping. Initially, he thought it was anxiety, then common insomnia. Next, he started recording times, room temperature, external noises, caffeine intake, and heart rate before going to bed. Nothing explained it. Interestingly, he did not feel fatigue proportional to sleep deprivation. His body remained functional, but his perception of the environment began to suffer slight distortions. Doors he was sure he had closed appeared ajar. Objects shifted position by a few centimeters. A faint smell of damp wood emerged only during the early morning hours, always at 3:17 a.m. 2 weeks after the move, Richard sought help from the hospital's sleep medicine department. The neurologist in charge, Dr. Alan Reeves, conducted basic tests and recommended monitoring. "The body can't sustain total deprivation for that long," Reeves explained. "Some level of sleep is occurring, even if you don't realize it." Richard disagreed. He remembered every minute. Home monitoring was initiated with portable sensors and a detailed diary. The first few nights recorded unusual brain activity, patterns close to a state of continuous wakefulness, with microfluctuations that did not characterize actual sleep. Reeves reviewed the data 3 times. "That's not typical," he admitted. As the medical investigation progressed, the house appeared to be reacting to the scrutiny. In the 3rd week, Richard began hearing footsteps above his room in the middle of the night. The problem was simple. There was no habitable upper floor, just a low, empty attic, accessible by a retractable ladder. In the 4th week, he decided to go up. The flashlight illuminated old beams, boxes abandoned by former owners, and a partially sealed circular window. Dust floated in the still air, nothing more, but when Richard came down, he noticed something he hadn't registered when he went up. The ladder was positioned differently, tilted a few degrees to the side. A small detail, enough. That night, he installed a camera in the hallway. The video captured 8 hours of motionless darkness, except for one single moment. At 3:17 a.m., the camera lost focus for 4 seconds. There was no power failure or loss of recording, just a granular distortion, similar to analog interference. When the image returned, the bedroom door was open. Richard clearly remembered closing it. At the hospital, Reeves began to treat the case with growing scientific interest. The prolonged absence of sleep without physiological collapse contradicted established clinical standards. Other doctors began to comment. One resident suggested dissociative disorder. Another mentioned nocturnal automated episodes. A psychologist hypothesized distorted perception associated with post-move stress. Richard listened to everyone, but he didn't agree with any of them. The fifth week brought the first visible consequence. During an administrative meeting, Richard stopped speaking mid-sentence. His gaze remained fixed for about 10 seconds, as if he were listening to something in the distance. When he resumed the conversation, he apologized and continued as normal. But a colleague later reported that at that moment, Richard seemed empty. That same night, he wrote in his diary, "It's not lack of sleep, it's something else." Days later, Reeves received new lab results. Elevated but stable stress hormones, irregular circadian rhythm, a typical but consistent nocturnal brain activity. The doctor initiated a more thorough investigation, and that's when the first detail external to the patient emerged: the history of the house. A long-time hospital employee, upon hearing Richard's address, casually commented, "That house has had residents who also complained of insomnia." The information seemed trivial, but it wasn't. Reeves requested public records, frequent changes of ownership, short stays, vague accounts in real estate interviews about nighttime discomfort, nothing formal, nothing clinical. Nevertheless, the pattern existed. By the 6th week, Richard stopped trying to sleep. He spent the early hours of the morning sitting in the living room, observing the house as if awaiting an inevitable revelation. At 3:17 a.m., the air seemed denser. At 3:18 a.m., he was absolutely certain that he was not alone, and in the 7th week, something new happened. The sleep study sensors recorded, for the first time, a deep sleep pattern consistent with REM sleep. Total duration, 47 seconds. During that interval, the hallway camera captured movement inside the room. Richard was asleep, but someone was walking. The hospital where Richard worked had a predictable routine that contrasted sharply with the silent chaos that dominated his nights. During the day, he was efficient, punctual, and functional. At night, he became an unwitting observer of a phenomenon that no one seemed to fully understand. Dr. Alan Reeves began to follow the case not only as a doctor, but as a researcher. There was something in the data that defied common explanations. Richard's brain activity suggested a kind of forced wakefulness, as if the brain refused to completely cross the boundary of sleep. Reeves called for the participation of 2 professionals. The first was Melissa Grant, a clinical psychologist specializing in perceptual disorders. Observant and quiet, Melissa had a habit of listening more than asking. During the first session, she noticed that Richard described events with almost documentary precision, avoiding emotional interpretations. "How do you feel when you notice these changes in the house?" he asked. Richard took a while to reply. "It's not fear, it's anticipation." The answer stayed in Melissa's mind for days. The second professional involved was neurodiagnostic technician Clara Whitman, responsible for reviewing the recordings of the sleep study. Clara possessed an unusual ability to identify subtle patterns in long sequences of data. On the 3rd night of analysis, she found something strange. Richard's micro-awakenings showed almost perfect temporal synchronization with small environmental variations captured by the house's sensors. A minimal drop in temperature, a slight increase in humidity, and a change in frequency in low-intensity noises. Taken in isolation, it meant nothing. Together they formed a pattern. Meanwhile, Richard tried to maintain some semblance of social normalcy. He met his next-door neighbor, Thomas Bell, a retiree who spent long periods observing the street from his balcony. Thomas displayed restrained curiosity. "Have you been sleeping well there?" he asked casually one afternoon. Richard responded with an ambiguous gesture. Thomas nodded, as if he had expected it, As the days went by, small stories began to emerge in fragments. A previous resident who had installed blackout curtains and moved out 3 months later. A family who claimed they had trouble adapting. A real estate agent who avoided commenting on the property. None of the accounts were explicit, but they were all pointing in the same direction. Inside the house, Richard began to notice changes in his own perception of time. Early mornings seemed longer than the clock indicated. Sometimes he had the feeling that hours had passed when only minutes had gone by. He began recording audio during the night, describing the environment in real time. The records revealed something disturbing, prolonged pauses in which Richard remained in absolute silence, followed by abrupt resumptions, as if he had forgotten what he was doing. When he listened to the audio recordings the next day, he didn't remember those pauses. Melissa interpreted it as a possible mild dissociation. Reeves disagreed. Clara found another detail. During the hallway camera interference, an extremely low background noise emerged, similar to distant breathing amplified electronically. The sound was not present at other times. The team decided to expand environmental monitoring. Additional sensors were discreetly installed throughout the house under technical justification. Richard agreed without hesitation. In fact, he showed relief at realizing that others were also beginning to observe what he was experiencing. The new measurements yielded perplexing results. Between 3:16 a.m. and 3:18 a.m., a subtle change occurred in the internal pressure of the residence, as if doors were being opened and closed simultaneously at different points. However, no motion sensor detected any physical displacement. Clara described the phenomenon as trajectoryless space activity. The expression continued to echo in everyone's mind. Meanwhile, Melissa delved into Richard's personal history. She discovered a recent period of family loss and an abrupt career change, factors capable of triggering severe insomnia. But nothing explained the consistency of the environmental data. One afternoon, Thomas Bell invited Richard for coffee. The conversation started casually, but slowly drifted towards home. "Have you noticed how different the sound is in there?" Thomas commented. Richard confirmed. Thomas then revealed that years earlier he had helped a former resident remove furniture. He remembered a peculiar feeling upon entering the empty house, as if the space had greater depth than its external dimensions suggested. "It seemed like the house continued beyond the wall," he said. Richard did not respond immediately. That night, he walked the hallways with a measuring tape. The measurements were correct. Even so, the feeling persisted. During the following night, sitting in the living room, Richard had the impression of hearing his own voice coming from upstairs, an impossible echo of something he hadn't said. The sensors again registered the pressure change. At 3:17 a.m., at the hospital, Reeves gathered the team. "We are dealing with a patient who is not noticeably sleepy, an environment with minimal physical variations, and inconclusive audio-visual recordings," he summarized. "We need to consider the interaction between perception and physical space." Melissa asked the question that no one wanted to ask. What if the problem isn't just with the patient? The silence that followed was more revealing than any answer. That same night, Clara noticed something new in the recordings. During Richard's 47 seconds of REM sleep, the recorded breathing pattern did not correspond to just one person. There was a second rhythm, slower, synchronized, inside the room. The discovery of the second respiratory pattern transformed what was a case of clinical curiosity into a concrete concern. Clara reviewed the data repeatedly, isolating frequencies, filtering out noise, and comparing it to reference sets. The result remained unchanged. During Richard's brief sleep episodes, an additional breathing rhythm emerged, perfectly detectable by the proximity sensors. It wasn't interference, it wasn't an echo, it was an acoustic presence. Reeves called an urgent meeting with Melissa and Clara. The discussion oscillated between unusual physiological hypotheses and improbable instrumental failures. The possibility of another person in the residence was quickly ruled out. External cameras and access sensors did not register entry or exit. Nevertheless, the data existed. Meanwhile, Richard was experiencing the silent progression of the phenomenon. The feeling of being constantly watched evolved into something more specific, the impression that the house reacted to his decisions. When he stayed in the living room, noises arose in the bedroom. When he went up to the attic, the living room emitted subtle creaking sounds. It was as if his presence triggered invisible movements. He started testing. One night, he stood motionless in the hallway for 20 minutes. No noise. As he took a step, the floorboards creaked in the opposite room. Another step. A faint, dragging sound echoed above. Richard wrote everything down. The house seemed to maintain a constant distance from him. The pattern caught Melissa's attention, who interpreted the behavior as an attempt to regain control over an unpredictable environment. However, Richard described his actions without apparent anxiety, only growing curiosity. The following week, Reeves authorized an intensive 3-night study with enhanced monitoring. Additional equipment would capture structural vibration, electromagnetic variation, and microcurrents of air. The first night passed without any significant events. On Monday, at 3:17 a.m., all sensors recorded simultaneous changes. Minimum temperature remains, change in pressure, video interference, and the second breathing pattern. But something new emerged. A vibration sensor installed in the bedroom wall picked up regular pulses, similar to heartbeats transmitted through the structure. The intensity was too low for human perception, but consistent for 62 seconds. Clara isolated the graph. The rhythm didn't match Richard's heartbeat. The following morning, Reeves visited the house in person for the first time. He walked through the rooms with an analytical posture, observing materials, ventilation, acoustics, and possible mechanical sources. Nothing explained it. In the attic, he found old marks on the floor, almost erased parallel grooves, as if a heavy piece of furniture had been dragged repeatedly over the years. Richard stated that he hadn't moved anything there. During the inspection, Reeves noticed something unsettling. The sound of footsteps seemed muffled, while noises coming from other parts of the house were amplified unevenly. He mentally noted it down. On the third night of the intensive study, the team decided to conduct real-time remote monitoring. At 3:12 a.m., Richard was sitting on the bed reading. At 3:15 a.m., he closed the book. At 3:16 a.m., he turned off the light. At 3:17 a.m., the monitors displayed interference. The room was enveloped in digital grain. The respiratory sensor indicated 2 patterns. And then, the most disturbing event up to that point occurred. The weight sensor installed under the mattress registered an increase in load equivalent to approximately 18 kilograms distributed laterally to Richard's body. No image visible, no movement recorded, but the weight remained for 31 seconds. Clara took her hands off the keyboard. Melissa felt her breath shorten. Reeves remained motionless in front of the screen. When the interference ceased, the weight disappeared. Richard remained lying down, seemingly awake. The following morning, he reported only a brief sensation of pressure on his side, initially interpreted as an involuntary muscle contraction. Upon hearing the team's explanation, he showed no surprise. "I thought that was it," he said. The phrase changed the atmosphere in the room. For the first time, Richard verbalized a confirmed expectation. In the following days, the conflict took on a new dimension. Richard began to notice changes in his personal belongings. Photographs slightly tilted. A glass moved a few centimeters. A book opened to a different page than the one marked. Minimal changes, but cumulative. Melissa also noticed a behavioral change. Richard spoke less about the possibility of explanation and more about coexistence. "It doesn't seem hostile," he commented during a session. "It seems persistent." Meanwhile, Thomas Bell observed the house with increasing attention. On a rainy afternoon, he commented that the interior lighting sometimes varied subtly, even without any apparent movement of the lamps. "As if someone were walking in front of the light," he said. Richard checked the electrical records. No fluctuation. The central conflict was no longer just the lack of sleep. It was becoming a silent struggle for perceptual space. In the 8th week, the first episode outside of the early morning hours occurred. Richard was in the kitchen when the radio plugged into the counter abruptly changed stations, emitting white noise for a few seconds before returning to the original channel. The event was recorded by electromagnetic sensors. Reeves understood that the phenomenon was expanding its temporal boundaries. The following night, Richard decided to conduct a simple experiment. Before going to bed, he spoke aloud. "If there's something here, I'm not trying to leave." There was no response. But at 3:17 a.m. during the brief REM sleep episode, the second breathing pattern reappeared, this time closer, and the weight sensor indicated a load of 22 kilograms. With the advancement of monitoring and the accumulation of unexplained data, Richard's case ceased to be just an isolated clinical study. It became a growing network of small parallel stories that slowly began to converge on the same silent center, the house. Within the hospital, the team's involvement began to generate internal repercussions. Comments circulated in the hallways, some filled with scientific curiosity, others with evident skepticism. A group of residents requested access to the data, while more senior members of the administration expressed discomfort with institutional involvement in something that lacked a clear diagnosis. Reeves faced subtle pressure to end the study, but the results kept coming in. Clara, immersed in the analysis, began to notice an unexpected characteristic. The nighttime events were not completely random. There was a gradual progression of intensity, as if the phenomenon were learning to manifest itself in a more perceptible way. Interferences were becoming slightly longer. The recorded weight was increasing. Breathing patterns became more stable. The hypothesis of progression was initially met with caution, but no data contradicted it. Meanwhile, Melissa was developing another storyline. During conversations with Richard, he realized that his emotional relationship with the house had transformed. Initially, he treated it as a problematic space. Now, he described it as a shared environment. "It's not an invasion," he explained. "It's coexistence without an agreement." The phrase suggested profound psychological adaptation. Melissa began investigating possible mechanisms of perceptual accommodation. Situations in which individuals exposed to persistent stimuli cease to interpret them as a threat, integrating them into their routine. But there was one unsettling detail. Typically, this accommodation reduces the perception of the stimulus. In Richard's case, the perception increased. Meanwhile, a subplot emerged through Thomas Bell. The neighbor, previously just an observer, began to recall old episodes from the street. He spoke with longtime residents and pieced together fragments of memory that had never been connected before. A musician who reported difficulty composing after moving into the house. A teacher who mentioned a constant feeling of being on edge. A couple who claimed silent presence in an informal statement years earlier. No formal report, no complaints, just patterns scattered across time. Thomas handed his notes to Richard in a thin folder. "Perhaps it's not just your story," he said. The information broadened the scope of the conflict. Richard wasn't the first to experiment on something in the house, just the first to document it systematically. Inside the residence, new complexities arose. Richard began to notice that nighttime events had spatial variations. Certain rooms showed more intense activity, especially the central hallway and the master bedroom. Others remained practically neutral. He mapped occurrences on the house plan. The result revealed a linear concentration that ran through the structure from front to back, like an invisible axis. Clara compared the map with vibration data. The correspondence was high. Meanwhile, Reeves deepened his historical investigation of the property. Architectural records showed successive renovations over the decades, including the removal of interior walls and poorly documented structural alterations. One particular renovation caught our attention: the removal of an original internal staircase that directly connected the bedroom to the attic. The information seemed trivial, but the axis of occurrences mapped by Richard coincided with the estimated position of that old staircase. The current house contained traces of a path that no longer existed. This discovery created a new layer of interpretation. Not only did events occur, they followed absent trajectories. In his personal life, Richard began to exhibit noticeable behavioral changes outside the home. At work, he would show brief moments of auditory distraction, as if trying to pick up sounds from afar. Colleagues noticed that he would sometimes pause conversations to listen to the silence. Melissa identified the phenomenon as perceptual generalization, when intense experiences in one environment begin to influence how an individual perceives other spaces. Nevertheless, Richard remained functional. That's curious. Another subplot emerged from the equipment itself. On 2 occasions, newly installed sensors showed altered calibration without any record of physical manipulation. The settings corresponded exactly to the average levels of previous events, as if the system had been configured to anticipate them. Clara ruled out external intervention. "It's as if the environment is establishing its own baseline," he commented. The observation remained unanswered. Time pressure also began to manifest itself. The institution requested an extension to complete the study, and Reeves received formal communication questioning the continuation of funding. Simultaneously, Richard received a job offer to transfer to another hospital, a significant career opportunity. The decision meant leaving the house. For the first time, a concrete time limit for the phenomenon has emerged. On the night he received the offer, Richard remained seated in the room late into the night, observing the central corridor. He registered nothing unusual, but described a clear sense of ambient anticipation. At 3:17 a.m., the most significant video interference to date occurred: 19 seconds of continuous distortion. The sensors recorded 3 breathing patterns, and the weight sensor indicated that the load was distributed around the bed, not just to the side. The presence of 3 respiratory patterns marked a silent breakthrough in the understanding of the phenomenon. Until then, all records suggested a singular interaction between Richard and something unidentified. Now, the data indicated multiplicity. Clara was the first to realize the real implication. She overlaid the respiratory charts from different nights and identified consistent variations between the secondary patterns. It wasn't a case of sound duplication or ambient echo. There were distinct rhythms, with their own intervals and amplitudes, more than one presence. The discovery was communicated to Reeves and Melissa the following morning. None of the 3 attempted to offer an immediate explanation. The mere fact of it profoundly altered the narrative constructed up to that point. Meanwhile, Richard reacted in an unexpectedly calm manner. "I always thought the house was too big for just one feeling," she commented. The phrase made Melissa uncomfortable, as she perceived a growing normalization of the inexplicable on the part of the patient. The turning point, however, didn't just happen in the data. The real event began 2 days later. Reeves received official confirmation. The hospital would end funding for the study within a week. The case was to be closed, archived, or transferred for external investigation. The justification was simple: absence of an objective clinical diagnosis. The observation period was coming to an end. Reeves informed Richard that afternoon. The proposed professional transfer remained open, creating an inevitable convergence of decisions. To remain meant to continue without formal answers. Leaving meant abandoning the investigation at its most critical moment. That night, Richard decided to change his routine. Instead of passively waiting for the 3:17 a.m. event, he planned to stay awake in his room with the lights on and all equipment running, directly observing any occurrence. At 2:50 a.m., he was already sitting on the bed. At 3:05 a.m., continuous audio recording began. At 3:12 a.m., he described the environment in a low voice. At 3:16 a.m., the air became noticeably colder. The sensors confirmed a temperature drop. At 3:17 a.m., the interference began. But for the first time, Richard remained conscious and visually alert throughout the entire event. What occurred was not visible movement, but spatial alteration. The room's lighting seemed to lose depth, shadows became denser, and the edges of objects acquired indistinct outlines, as if the space were slightly out of focus. Richard described it in real time. "It looks like the room is expanding." The weight sensor registered a load distributed around it. 3 breathing patterns emerged, and then the decisive element occurred. The recorder picked up a 4th sound source. It wasn't breathing. It was a brief sound, similar to the creaking of a step under light weight. Clara immediately identified it in the subsequent analysis. It acoustically corresponded to compressed wood, exactly the type of noise produced by old staircases. The ladder was removed. Simultaneously, the vibration sensor installed on the center line of the house recorded an upward sequence of micro-impacts, like footsteps traveling along a non-existent vertical path. The axis mapped by Richard was activated as a functional passage. For 23 seconds, the sensor array indicated continuous movement between the attic and the bedroom. No visible movement. No one. But a clear trajectory. When the event ended, Richard remained motionless for almost a minute before speaking again. "I don't think I'm the focus," he said. The interpretation slowly emerged in everyone's mind. Perhaps the phenomenon was not related to Richard as an individual, but to the house as a dynamic structure, where he occupied only a temporary position. In the following days, the team focused its efforts on reviewing all records from this new perspective. The patterns became evident. Events followed old structural paths. Multiple presences coexisted. Richard experienced sleep problems, primarily in the room located on the former vertical axis. The phenomenon was not patient-centered. It was geographical. Final confirmation came through Reeves, who managed to access a detailed retirement document filed with municipal records. The material included an original floor plan of the house, revealing not only the removed staircase, but a small intermediate landing between the bedroom and the attic, a place to stay, a place where someone could stop. When Richard overlaid the original plan onto the map of occurrences, the point of greatest intensity coincided exactly with this non-existent plateau. The following night, Richard positioned an additional sensor at that theoretical point in space. At 3:17 a.m., the sensor recorded localized atmospheric pressure, as if something occupied a space where there was no floor. The turning point had been reached. The investigation stopped looking for who and started asking where. And the new question made Richard's decision even more difficult, because leaving the house would mean abandoning the only place where the phenomenon seemed fully active. The realization that the phenomenon was linked to space and not exclusively to Richard produced an immediate change in the attitude of everyone involved. The case ceased to be an individual disturbance and took on characteristics of a persistent environmental interaction. For Reeves, the consequence was practical and urgent. The termination of the institutional study became even more problematic. It was not simply a matter of suspending the monitoring of a patient, but of interrupting the observation of a physical pattern that was still active and progressively more complex. He requested an extension. The answer was no. Without a medical diagnosis, there would be no formal justification. This decision triggered the first reaction of rupture within the team. Clara, normally reserved, expressed direct opposition to archiving the data. "We are documenting something consistent," he stated. "Shutting down now means missing the point of peak activity." Melissa, though more cautious, recognized the potential psychological impact of the abrupt interruption on Richard. Prolonged exposure to the phenomenon had become part of his daily reality. The simultaneous withdrawal of scientific support and a possible change of residence could lead to significant perceptual disorganization. While the team dealt with external limitations, Richard reacted internally. The new spatial understanding transformed his relationship with the house. He stopped merely observing events and began to explore invisible trajectories. He walked slowly along the mapped axis, stopping at points of greatest occurrence, remaining motionless as if awaiting a response. There was no fear. There was recognition. This behavioral change was noticed by Thomas Bell, who discreetly observed his neighbor's movements through the window. One afternoon, he commented that Richard seemed to be following paths that didn't match the layout of the rooms. "You walk as if you were on another plant," he said. Richard did not deny it. The most obvious consequence came the following night. For the first time, the 3:17 a.m. event occurred partially earlier than usual. At 3:14 a.m., sensors recorded a slight drop in temperature and a change in pressure. The phenomenon seemed to anticipate the established pattern, as if responding to Richard's increased attention to space. Clara interpreted it as temporal modulation, Melissa as an increase in perceptual salience. Reeves avoided drawing conclusions. Another reaction emerged from within the home itself. Objects positioned along the invisible axis began to exhibit minimal but consistent displacements. A subtly wrinkled rug, a slightly rotated chair, a frame tilted always in the same direction. Richard documented everything. The directional repetition suggested flow. Time pressure was also intensifying. The study's deadline was approaching, and Richard's career decision remained pending. The convergence of these variables produced a state of suspension, a feeling that something awaited resolution before proceeding. In the psychological realm, Melissa noticed an unexpected reaction in Richard. Resistance to the idea of leaving, not due to conventional emotional attachment to the house, but because he perceived his presence there as having an observational function. "If I leave, nobody will see," he explained. The phrase shifted his position from resident to witness. Meanwhile, Reeves decided to conduct one last on-site inspection before the official closure. Armed with the original blueprint, he meticulously examined the structural axis. At the point corresponding to the former intermediate landing, he remained still for several minutes. He later reported a mild, transient sensation of dizziness with no apparent physiological cause. He was the first team member to experience something subjective inside the house. This experience altered her scientific approach, making her more cautious and simultaneously more committed. That same night, the event occurred that would solidify the consequences of the turning point. At 3:16 a.m., Richard was positioned exactly over the old landing point, as he had been doing in previous days. Sensors detected a gradual increase in humidity and localized pressure. The interference started at 3:17 a.m., but this time, Richard wasn't in the room. He was on track. The records revealed a phenomenon different from previous ones. Instead of multiple presences around him, there was a convergence of breathing patterns along the structural line of the house, like an invisible corridor being traversed simultaneously. The atmospheric sensor positioned at the landing point recorded a downward vertical displacement of air, despite the absence of a physical opening. Richard described a sensation of a light current passing through him, with no apparent origin. The event lasted 41 seconds. After it stopped, he reported something new. "It doesn't look like they enter the room," he said. "It looks like they pass by it." The interpretation completely redefined the dynamics observed up to that point. The house was not the destination, it was a passage. This conclusion produced mixed reactions. Clara focused on technically validating the spatial flow hypothesis. Melissa turned to the psychological impact of inhabiting a place perceived as an invisible transit zone. Reeves faced the growing frustration of having to end the observation just when the phenomenon was revealing a new interpretative framework. And Richard, for the first time since the move, considered the possibility that his insomnia might not be a side effect, but it's a necessary condition. The hypothesis that his insomnia might represent more than just a symptom profoundly altered Richard's attitude toward the phenomenon. For weeks, he had sought an explanation, control, or at least adaptation. Now, the possibility of a function emerged. Not sleeping could mean remaining available for viewing, available for registration, available to coexist with whatever was passing through the house. This realization didn't emerge as a dramatic revelation, but as a gradual adjustment. Richard began to deliberately reorganize his nightly routine. Instead of trying to resist constant awakenings, he started structuring the early morning hours as active periods of observation. She prepared light coffee, reviewed notes, adjusted sensors, and walked slowly along the invisible axis. The house ceased to be a passive setting and became a work environment. Melissa noticed the change in the following session. Richard spoke with clarity and emotional stability, describing practical actions instead of uncertainties. The lack of sleep remained, but the associated anxiety had significantly decreased. "I stopped expecting it to stop," he explained. The phrase represented acceptance without resignation. Melissa interpreted it as a healthy, adaptive reorganization in the face of a persistent and insurmountable stressor. The focus shifted from eliminating the phenomenon to functional integration. Meanwhile, Clara was making technical progress. She compiled all the environmental records and created an approximate three-dimensional representation of the observed dynamics. The model indicated recurring upward and downward trajectories along the structural axis, with small lateral variations corresponding to events in the room. The pattern resembled flow, but a flow that ignored current physical barriers. When she shared the model with Richard, she noticed his silent reaction of immediate recognition. "That's what I feel when I'm there," he said, pointing to the spot where the old platform used to be. This convergence between subjective perception and technical representation strengthened the collective conviction that something coherent was being observed, even without formal explanation. Meanwhile, Reeves faced the final institutional challenge. Without funding and with the deadline expired, he decided to maintain informal voluntary monitoring until Richard's definitive departure or a clear change in the phenomenon. It was a personal choice and ethics. In the external sphere, Thomas Bell was also experiencing a subtle transformation. Initially curious, he now demonstrated a protective involvement. He began to observe the house not only as a neighbor, but as someone witnessing an unusual narrative unfolding. One afternoon, he commented to Richard, "Some houses keep things hidden. Yours seems to let them slip through." The distinction was clear. Inside the house, Richard began his own behavioral experiment. If the phenomenon represented a passage, perhaps its position within space influenced the experience. For several consecutive nights, it positioned itself at different points along the axis at the critical moment of 3:17 a.m. The results showed clear variations. In the bedroom, a feeling of presence all around. In the hallway, perception of lateral displacement. At the landing point, a feeling of crossing over. In the attic, original print. This spatial differentiation strengthened Richard's progressive understanding of the dynamics and simultaneously produced an internal change in him. His initial fear almost completely dissolved, replaced by methodological curiosity and cautious respect. Overcoming the problem did not consist of eliminating the phenomenon, but in abandoning the need to immediately classify it as a threat. Another aspect of growth manifested itself physically. Despite the prolonged absence of perceived sleep, tests continued to show surprising physiological stability. Reeves monitored parameters closely but found no significant deterioration. Richard's body appeared to be operating in a borderline sustainable state. This realization reinforced his sense of belonging to the situation. However, new challenges arose. The proximity of a career decision and a possible residential change introduced a growing practical conflict. Staying meant continued observation, but career stagnation. Leaving implied an abrupt break with the environment that had structured her recent experience. Richard began to evaluate the decision not only from a personal perspective, but also from a phenomenological one. If the house was merely a temporary space, would its permanence be relevant or incidental? The question remained open. The following night, an event occurred that would symbolize his growth. Richard positioned himself on the landing at exactly 3:17 a.m., as he had been doing. When the interference began, he remained motionless, breathing slowly, without attempting to verbally record the experience. For the first time, it simply remained. Sensors captured the usual flow. Multiple breathing patterns, air displacement, but a new piece of information has emerged. Richard's heart rate monitor indicated a gradual reduction in heart rate during the event, approaching typical patterns of deep relaxation. It wasn't sleepiness, it was peaceful. After the breakup, he wrote only one sentence in his diary: "I don't need to understand in order to not resist." This entry marked the culmination of his personal growth within the narrative. He had neither solved the mystery, nor regained his sleep, nor eliminated the phenomenon, but she had transformed her relationship with him, and in doing so, he was preparing to face the final decision that was approaching. With Richard's internal transformation consolidated and the institutional deadline rapidly approaching, the narrative entered its inevitable compression phase. All variables, personal, scientific, and spatial, converged on a decisive point. The first step in this preparation was practical. Reeves gathered the team for a final session to thoroughly review the accumulated data. Hours of recordings, environmental graphs, behavioral records, and spatial maps were organized chronologically, revealing a clear progression, a gradual increase in intensity, the definition of trajectories, and the temporal modulation of the phenomenon. Nothing indicated randomness. The consistency of the records produced a paradoxical effect. The more consistent the phenomenon proved to be, the less room there was for conventional explanations. Clara focused on consolidating the final three-dimensional model of the observed flow. The result showed a recurring vertical sequence starting in the attic, crossing the non-existent landing point, and partially dispersing into the bedroom before dissipating. An incomplete journey, or interrupted. This interpretation generated a new hypothesis. Perhaps the room was not a destination, but an area of dispersal caused by the physical absence of the original staircase. The structural removal could have altered the continuity of the flow. Richard absorbed the idea with silent attention. Meanwhile, Melissa led final conversations focused on the impending decision. Instead of exploring fears or symptoms, she focused on Richard's ability to act in a way that was consistent with his experience. "Regardless of the choice, what do you need to preserve?" he asked. Richard answered without hesitation, "The record." The answer summarized his journey. The house could be left. The observation is not. Meanwhile, Thomas Bell made an unexpected contribution. After speaking with a retired real estate agent, he gained informal access to photographs of the house's interior prior to the renovation that removed the staircase. The images clearly showed the small intermediate level. But one detail caught our attention. On the landing, there was a simple chair positioned against the wall, as if someone were still there. Richard stared at the photograph for several minutes. The image did not explain the phenomenon, but it provided symbolic materiality to the point of greatest intensity, a place to pause, a transitional space. Inside the house, Richard began the final preparations for intensive observation. He repositioned sensors, reviewed calibrations, and established a personal protocol for the last week, to remain at the observation point every morning until his final decision. Not as an isolated experiment, but as a methodological conclusion. In the first few days, the events maintained their usual pattern: flow, interference, multiple respiratory rhythms, and air displacements. However, small variations began to emerge. The average duration has increased. The convergence of patterns has become more synchronized, and occasionally, sounds similar to footsteps on the non-existent staircase became more frequent. Clara interpreted it as a final intensification, Melissa as an increase in selective attention. Reeves avoided labeling. External pressure also reached its peak. The hospital formally closed the case and requested the archiving of institutional equipment. Reeves only managed to obtain a brief extension for gradual withdrawal, allowing for a few more nights of monitoring. Time became measurable. On a personal level, Richard was given a deadline to respond to the job offer. The temporal coincidence did not go unnoticed by him. The decision about his career and the conclusion of the phenomenon seemed to occur within the same narrative timeframe, as if both were waiting for a simultaneous resolution. On the second to last night before the deadline, a distinct event occurred. Positioned at the landing point, Richard realized that the sensation of flow was no longer limited to the vertical passage. There was a brief impression of permanence around him, as if the trajectory slowed down at that specific point. Sensors recorded localized increases in acoustic density and micro-variations in pressure that did not indicate continuous displacement. It was a break, the first recorded pause. Richard didn't move. The event lasted 52 seconds before resuming its usual pattern and dissipating. Further analysis confirmed. For the first time, the flow had not only passed through the point, it had remained there. The discovery redefined expectations for the final night. If the plateau represented a pause within the trajectory, its continuous occupation by Richard could be altering the dynamics of the phenomenon. This possibility established the final scenario. The equipment would be removed soon. The decision to move was drawing near, and the point on the platform, now recognized as a temporary location, became the epicenter of the final observation. The following night, Richard quietly tidied the house, turning off unnecessary lights and reducing external stimuli. He walked down the central hallway one last time before positioning himself at the invisible point. There was no tension. There was preparation. The clock was approaching 3:17 a.m., and for the first time since he had moved, Richard felt that the event of that morning would not be just another record. That would be the answer. Last night began without any indication of anything exceptional. The house remained silent, immersed in that dense stillness that Richard had learned to recognize not as an absence of sound, but as expectation. Sensors were active for the last time under the remote supervision of Clara and Reeves, while Melissa watched only as an observer, aware that the moment transcended the therapeutic field. At 1:40 a.m., Richard was already awake. At 2:15 a.m., he reviewed his notes. At 2:50 a.m., he turned off the rest of the lights. Shortly after 3 a.m., he positioned himself at the point of the old platform, the space that did not physically exist, but which had become the functional center of everything that had been observed. He remained standing, No manual recorder, no comments made aloud, just being there. At 3:14 a.m., the first signs appeared: gradual temperature change, minimal pressure change, electromagnetic oscillation. The indicators appeared simultaneously on the remote monitors, and Clara immediately realized that the intensification curve surpassed any previous record. At 3:16 a.m., the entire house experienced mild interference. Cameras displayed consistent graininess. Microphones picked up low-frequency white noise. The real-time three-dimensional model began recording multiple activity points along the axis. Not a flow, several. Richard felt the air change density around his body, as if the space acquired an imperceptible viscosity. The sensation was not of physical contact, but of compressed spatial coexistence. He kept his eyes open, slow breathing. The event started at 3:17 a.m. The respiratory sensors simultaneously recorded 5 distinct patterns. The pressure sensor at the plateau point showed the highest value ever recorded. And then, for the first time, something occurred within Richard's visual perceptual field. It wasn't a defined form, no clear movement. It was a geometric alteration. The corridor before him seemed to extend for fractions of a second beyond its actual length, as if the space were opening up an invisible continuity. The shadows along the walls became deeper and aligned vertically, forming a sequence reminiscent of implicit steps. The missing staircase manifested itself as a perceptual structure. Simultaneously, the characteristic sound of footsteps on wood emerged again, not isolated, but sequential, multiple, and rhythmic, traversing the non-existent vertical trajectory. The sensors confirmed overlapping upward and downward vibrations. The axis was fully active. Richard did not back down. The lingering presence that had been observed the previous night was repeated, but amplified. The flow slowed at the landing point, producing an unmistakable sensation of passing through it. Not laterally, not frontally, through, like a current flowing through a volume. His heart rate slowed again, approaching the state of deep relaxation observed earlier. But then came the final twist. Among the multiple breathing patterns, Clara identified a rhythm that did not correspond to the previous ones. A pattern synchronized with Richard's breathing, but displaced by fractions of a second. An active echo. Meanwhile, Richard noticed an equally subtle internal change. His own breathing seemed to respond to the ambient rhythm, involuntarily adjusting to a collective cadence. It wasn't conscious imitation, it was alignment. For a few seconds, sensors recorded partial synchronization between all detected respiratory patterns. The flow had transformed into a chorus. Atmospheric pressure reached its peak. The sound of footsteps ceased, and the space gradually returned to its usual configuration. The event lasted 1 minute and 28 seconds, more than double the previous record. When the interruption ended, the house fell into absolute silence. No secondary pattern, no vibration, no temperature change. Richard remained motionless for several seconds before taking a deep breath. At that moment, he understood something that no amount of data could demonstrate. The insomnia was not a consequence of a presence outside of compatibility conditions. While all previous events represented a continuous passage through an interrupted space, his constant vigilance had allowed the formation of a conscious point of permanence within the trajectory. He was not an outside observer, it was a stabilizing element. On the monitors, Clara watched the baseline return to zero activity. Reeves kept his eyes fixed on the charts. Melissa noticed silent tears welling up without any clear cause. Inside the house, Richard stepped out from the landing. Nothing happened. Another step. Silence. He walked to the room and lay down without preparing any equipment. The clock showed 3:26 a.m. For the first time since moving there, he fell asleep before dawn. The remaining sensors recorded 4 hours and 12 minutes of continuous sleep. No additional standards, without interference, no flow. The climax did not solve the mystery of the house, but he had closed Richard's role within himself. Even after everything that had been discovered, an unsettling feeling lingered in the air. It was as if the house, silent, old, and marked by time, still held something that refused to disappear. That night, as the wind blew through the cracks in the windows and made the curtains dance slowly, a decision was made. They had to go back to the basement, not out of curiosity, but because deep down, everyone knew. The story wasn't complete yet. The descent was made in silence. Each step creaked under the weight of their footsteps, echoing like a belated warning. The smell of damp wood and old earth seemed more intense than before, almost suffocating. The lantern illuminated only fragments of the path, forgotten boxes, furniture covered with sheets, rusty tools, and then something different. A space that had gone unnoticed before. Behind a partially fallen bookcase, there was a narrow, practically invisible door. The dark wood blended into the wall, and the small, worn doorknob seemed never to have been touched in decades. The door resisted at first, but he eventually gave in. On the other side, a tiny, windowless room with walls covered in empty shelves. In the center, just a chair and a simple table. Above it, a single object, an old tape recorder. The surrounding silence seemed to observe every movement as the device was switched on. The click of the button echoed through the small room like a gunshot. First, just noise, then a voice. Weak, tired, almost unrecognizable. It was a report, a confession. The recording described fear, isolation, and a growing feeling that something in the house wasn't just a memory or imagination. It spoke of sleepless nights, footsteps in the empty hallway, doors that shifted position, and whispers that belonged to no one. But the final stretch was what made the air feel chilly. The voice said that it had no intention of leaving, because he had understood something that others had not, that the house held no secrets. She kept secrets. He created stories, doubts, versions, until no one could distinguish what really happened anymore. The recorder stopped abruptly. No goodbye, without explanation, no name. For long minutes, nobody said anything. The discovery didn't bring answers. It brought a much bigger question. How many stories about that house were true, and how many had been shaped by the place itself? As I climbed the stairs again, a strange feeling accompanied each step. It wasn't fear. It was the unsettling feeling that from that moment on, they too were part of history, and perhaps in the future someone would find traces of their passage there. A forgotten photograph, an object out of place, or even a new recorded account, because some houses are more than just sets. They are witnesses. And others, they appear to be authors. After the discovery of the small hidden room and the unsettling recording, no one could sleep. The house looked different, not physically. The walls remained in the same place, the corridors maintained the same length, and the furniture remained covered in the same fine dust. But there was a change that was difficult to explain. It was as if the silence had weight. In the early morning hours, sounds began to emerge. First, slight creaking sounds, common in old buildings, then a distant dragging sound, similar to the movement of a chair being slowly moved. The problem was simple. There was no one else awake besides them. Or at least, that's what they believed. The flashlight illuminated the hallway, revealing only closed doors and motionless shadows. Still, the feeling of being watched grew with each step. It wasn't the typical fear of the unknown. It was something more intimate, almost personal. As if the house had realized its secrets were being exposed, and he didn't approve of that. Upon returning to the main room, something immediately caught their attention. The table where they had left the recorder was empty. The object had disappeared. The search began urgently. Every room was revisited, every cupboard opened, every box rummaged through. Nothing. until one detail interrupted the search. The door to the small secret room was open. They were certain they had closed it. The approach was slow. Inside the room, the chair remained in the center, but not exactly as before. Now it was slightly turned, facing the door, as if someone had gotten up a few seconds ago. On the table, the recorder. But there was something different. The tape was at the end, as if it had been used again. No one touched the device for several seconds. The air seemed thick, heavy with a silent expectation. When they finally pressed the play button, the noise reappeared. And then, steps. Breathing, a muffled sound of fabric rustling. No clear voice, only almost inaudible fragments, until, for a brief moment, a whisper emerged. A single sentence. You heard it too. The final click of the tape sounded definitive. There was no doubt. That had been recorded after they left the room. The shock was not accompanied by screams or running. It came with understanding. The house not only preserved records of the past, she continued documenting the gift. And perhaps he had always done that. The idea completely transformed the experience. Every conversation, every step, every discovery could be added to the invisible collection of that place. Stories accumulated like layers of dust, memories that no one remembered creating. At that moment, a silent question formed among everyone. If the house recorded everything, how many versions of them already existed inside? Dawn began to illuminate the windows, bringing an almost cruel contrast to the tension of the night. The light revealed an ordinary house, but now they knew. Normalcy was only an appearance, and what truly inhabited that place was not something that could be seen. It was something I noticed. I was listening, and above all, I was expecting it. Dawn brought with it an inevitable decision. It was time to go Embora, not because all the mysteries had been solved, far from it, but because remaining there meant continuing to feed something that no one fully understood. The house didn't stop them from going out, but he didn't seem to want them to leave either. The process of packing up the few things they had brought was silent, almost ceremonial. Each object collected seemed to mark the end of a chapter that could never be fully told. Before leaving, one last walk through the rooms. The room where they had spent hours discussing theories, the kitchen where the silence was broken only by the clinking of cups, the long corridor where more than once they had the feeling that they were not alone. And finally, the basement. The final descent happened without words. The small secret room remained there, motionless, discreet, as if it had never been discovered. The chair in the center, the simple table, and the tape recorder resting exactly where it had been left after the last playback. No one dared to touch it again. Some secrets don't need answers. They ask for distance. As I climbed the stairs for the last time, something curious happened. The constant feeling of being watched, present throughout my stay, began to gradually disappear, not abruptly, but like a sound that fades away, as if the house were slowly turning its attention elsewhere. Or perhaps for another time. The front door was carefully closed, and the click of the lock echoed like a final point. From the outside, the house looked like just an old building, silent under the soft morning light. No sign of what was inside. No trace remained of what they had lived through. But as they drifted apart, a collective understanding emerged without needing to be spoken. They weren't leaving the house behind. Some of them would remain there, not physically, but for the record. Like a memory, like yet another story added to those walls. Days later, already far apart, the experience began to take on almost unreal dimensions. Conversations were revisited, details compared, memories confronted, and curiously, small disagreements emerged. An object that one swore was in a certain place, a sound that only one other person remembered hearing, a door that someone was absolutely certain had remained closed. Doubt became part of the memory. And perhaps that was the true legacy of the house. Not fear, not the supernatural, but the uncertainty. Months later, a new owner visited the property for the first time. He walked through the rooms, observed the old architecture, commented on the property's potential, and inevitably ended up finding access to the basement. The descent was smooth. Then he noticed something behind a partially fallen bookcase, a narrow door, discreet, almost invisible. Upon opening it, he found the small room. The chair, the table, and the recorder, covered by a thin layer of fresh dust. Curious, he pressed the play button. Noise, silence. And then, multiple overlapping voices, fragmented, distant, like memories trying to exist simultaneously. Among them, for a brief moment, one phrase stood out, an unknown voice, perhaps old, perhaps recently, perhaps one of the many that passed by there. "You'll stay a little while too." The final click brought the tape to a close. Upstairs, the house remained motionless, bathed in the afternoon light. Serena, patient, as always. Because some houses are sold, others are inherited, and some, they continue to collect stories.